That's a big problem because bipolar, there are researchers such as Dr. Kiskow, the brilliant psychiatrist, has proven actually through research, not just surmising or opinion, but real research, that all depression is bipolar depression. There is no such thing as major depressive disorder. And back around the year 2008, I knew something was wrong with the diagnosis of depression, so I started looking up research. And I'd actually seen him give his very first presentation in Memphis in 1976. And he was a very serious guy, a young guy, never smiled. And that was about the time they started blowing up airplanes over in Beirut, Lebanon. That's where he came from, although he was Armenian in descent. So I kind of lost track of him, but then I got back and I found his research. And it pretty much proves that he's right. But most psychiatrists don't believe that. They cannot believe that he's right and everybody else is wrong. But I call it the Copernicus factor. You may or may not know who Copernicus was, but he was the first person to ever say the world was round. And he was the only person. And they put him in prison and tortured him for saying that. This was in the 1400s. And the Catholic Church forbade anybody to read his writings. But he was right. Because there are times in the world when one person is right and everybody else is wrong. And the Kiskow is like that. And I'm sort of in the same camp as he is. Because most psychiatrists don't understand what I'm talking about, which means I know I'm right. So we have tremendous success using these medicines. Now we may use some of the newer medicines when I have to. They're called atypicals, and they can work, but I prefer to use mood stabilizers most of the time. But I may add one of those to these other medicines if I need to. So that's kind of the long and short of it, but it's misdiagnosis is so common. I mean, they don't know they're missing a diagnosis. And I'll tell you what Kiskow did to prove this. If you ask 100 people who have bipolar disorder, bipolar 2 primarily, if you ask them, do they have mood elevations, only 40% say yes. So their mood elevations are so minor, they don't even know they're having them. And that's what misleads a lot of doctors. But if you ask them, do you have activity level changes, they light up. 95% say, yeah, I have. I've had those all my life. I don't know what causes that. And those are those little mild hypomanias. They're so mild, they don't even notice their mood has changed, but their activity, they have more energy, their activity level has changed. And they can get stuff done for a day or two, and then bam, they're back into depression. And every person I've ever seen since I read that article, if they come in for depression, I asked him, I said, do you ever wake up one day or 2 days a month where you have a little more energy, you feel better? Oh yeah, every single person says they're depressed has those. And that's what makes it bipolar. But most people, psychiatrists included, don't know that. It's in the literature, but you got to read it first.